This one's more just information, I think, but maybe you can put something on the end of it. My mother-in-law is in Aintree for her steroid injections into her eye, a treatment that they do offer to some at Nobles, but isn't life-saving, which David Ashford says is why people are being sent away, which we are just now keeping everything crossed that she comes back safe and without COVID. So I suppose the question is, could you have done that here in the Isle of Man rather than the extra issues of going across?
Well, firstly, I don't know where the comment about saying that because it's not life-saving, that's why we don't do it on the island, and that came from me, because that's completely and utterly untrue. That's not the case at all. I have had contact with people about this, and I have explained that there's a long history to this. Luke and I, as minister, wanted all eye injections on island. We used to partner with Aintree. We then went out for tender for someone to deliver all of this on island. We did receive a tender who said they would do it all on island. That person then withdrew, which nearly left us with no service whatsoever. So we had to go out to commission a service at short notice. Aintree agreed to take that service on for us, but the minimum they would do is as a 3-year contract, and they would not deliver a full island service. So although Aintree comes over to run clinics on island, they are not willing, as part of the tender, to do a full island service, which means people have to go over to Aintree to receive the injections. The alternative was we didn't accept that, and we actually lost the service altogether. But we will be going back out to tender in the future to try and get someone to work with us to deliver all of this on island. So we do some clinics on island, but the clinic slots are limited.
And as you've already said, people going across now can be moved up the queue for the vaccine, but the partners who go with them, if they do take someone, can't. Is that something that will be looked at again, or will that just be the way it will be?
No, that's the way it is, Paul, because we have to remember what the vaccination programme is based on. The vaccination programme isn't based on the likelihood of someone contracting COVID-19. The vaccination programme is based on the outcome if that person gets COVID-19. So the patient is at risk, because if the patient contracts COVID-19 with their likely underlying health conditions, there is a risk of serious illness or death. In relation to the escort, to be an escort, you are expected to be a healthy individual who is capable of supporting that patient and accompanying them. So in that case, although the escort would be at risk maybe of catching COVID-19, they would not be actually at risk of serious illness or death.
And do people have to take an escort, or is it up to them what happens?
No, most patients travel without escorts. Escorts only attend if it's deemed to be clinically appropriate. That's why I say escorts are expected to be able to assist the patient. It's not just there for someone to give support. They have to be an escort will only be authorised in situations where the patient needs physical support to be able to get to the hospital and back again. So escorts is actually quite low level.
So it's not up to the patient. It's actually up to the hospital to make the decision if someone needs assistance.
Yeah, there is a clinical assessment of the patient which decides whether the patient needs assistance, and that then dictates whether or not they have an escort.
Right, enough medical for a while. We've got something different here about airlines. It's all to do with the 3.3 million already given to Logan Air between April and November 2020, and perhaps another 3 to 4 million by the end of March. There has been no tender issued for this business and no procurement process followed. Many airlines feel manipulated or simply ignored. We now have all our eggs in one basket again, and there appears to be no aviation plan for the short or long term. Why was the patient transfer contract awarded to Logan Air in the last few months terminated by the AG's office? And why are Logan Air still flying to Liverpool with patients when there is no agreement in place? This seems seriously wrong. I should put allegedly in all that, because I don't know if that's, you can tell us now what's going on.
Well, in relation to the patient transfer service, there was issues identified with the last tender, so it will be going back out to tender. We have got to operate a patient transfer service. It's as simple as that. So in the meantime, the department does have the diaries to come to an arrangement to ensure that the patient transfer service can continue. The best way of doing that was to actually continue with the existing carrier, because if we didn't, we'd effectively be going out into a tender process, and that will be there until a tender is awarded. In relation to the other parts of the Logan Air contract, again, DOI does have the diaries to do that, to be able to underwrite certain air routes, and that's exactly what we've done, because it is important that we maintain our air links over this period. And let's be perfectly honest, as we've seen in the UK, lots of airlines now are closing routes and pulling out because it's no longer commercially viable for them to operate.
I guess what we don't know from that is if other airlines were interested, therefore there could have been a tender process, or it really was a case of Logan Air or nobody.
If you're talking about the patient transfer, there was a tender process, and as I say, there's been issues found with that, so we've decided to go back out to tender. But in the meantime, while we are going back out to tender, we've got to still run a service on a temporary basis, or we don't get any patients sent away, and that is not an acceptable situation. So basically, the department has the varies in these circumstances to be able to continue with the existing operator, and that is exactly what we've done.
This is about to me. You've asked twice now about the Ramsey hub, but you don't seem to be getting the answer exactly when will the North of the island get that service. And that's why I re-asked it, because I thought things may have changed, because obviously the airport, that changed from being a hangar into the thing. So everything seems a bit fluid, but you said yet no decision has been made on where it is, or you can't announce it. Let's be clear.
I can't announce it at the moment because there's three venues that are under consideration that we believe are suitable up there. And the final, and obviously it will be a clinical decision in the end, because it will be which is the best for delivering this clinical procedure. That is in the process of being decided now, but there are three venues under consideration that would actually work as a hub. In relation to when the hub will open, as I've stated before, it'll be towards the end of February, because all of the hubs are designed to come on stream as the delivery schedule goes up and as more vaccine comes into the island, because we need to get the throughput through. Because let's not forget, every time we open a hub, we are duplicating process, we are duplicating staffing, we are duplicating the administration that lies behind this vaccine, and we shouldn't underestimate that. There is, in order to comply with the manufacturer's license to be able to use the vaccine, and also to comply with the indemnity processes in place, there is an absolutely massive amount of paperwork that has to be conducted each and every time the vaccine is administrated, and we are duplicating that at the centres. So it is important that we have a consistent throughput to make that actually worthwhile, and that's why the Ramsey hub will be actually, or the Northern hub I should say, will be timed to coincide with the vaccine delivery increases, which is end of February, start of March.
I've got to tell you, there's a lot of interest in that question. I get asked that so many times, but anyway, we'll keep that one, updated as and when. Obviously, one of those vaccines needs this very low temperature, and we understand the reason for that hub, but the other one can be done by GPs, and certainly in the UK, it appears that GP services are being offered to do the vaccination. That won't happen here. It will all be done at the hub.
Yeah, it will, at the moment it will all be done at the hub. In terms of the GPs, we have engaged with the GPs, and as the deliveries roll out, we will be looking to primary care to help deliver the vaccine, but it will be delivered via hub units. Because again, as I say, what you've got to remember though is in the UK, when people see these pictures on TVs of church halls being used, of tents being put up, those church halls and those tents are covering populations that in some cases are actually larger than this island. So they're actually covering more than 85,000 people. And that's where I think sometimes it gets lost when we see the TV pictures. It makes it seem like they're using like St Thomas's Church or St George's Church across the road. They're not. They are creating vaccine hubs that cover, in a lot of cases, 100,000 people. But because we think on the scale we are at, it looks to us like it's every community hall and every community centre, which it's not.
Okay, so we've got a few more, so I hope you're okay with time.
Yeah.
This may seem a dumb question, but it needs asking. I need soap sanitizers, dispensers to put up. Do I wait till after lockdown, or is it classed as an important item because I have carers and I have low immunity issues, so I need them put up?
Well, in terms of the putting of them up, there's nothing to prevent them being put up. But in terms of the purchase, if that's what the person is talking about, that would depend upon where they're purchasing it from. Is it a retailer that is classed as an essential retailer or a non-essential retailer that's currently closed? But there would be nothing I can think of that would prevent someone putting sanitizer stations up. In fact, a lot of shops next week will be getting things ready to preparing to reopen on February the 1st.
Okay, you can help me with the pronunciation on this one. Why is ivermectin not widely prescribed? Is that close? Do you know what I mean?
Right, so yeah, I know which drug is being referred to here. In relation to this, the trials are still underway. So there is some trial data that shows that it is effective. that it does actually combat COVID-19, but equally there is other trial data, human trial data, that suggests it doesn't, and it doesn't have that effect, and it can actually have other effects on people who've been prescribed it as well. So from our point of view, although some countries have gone down the route of approving it, from our point of view, the trial data is still out, and should the trial data show that it is effective, just like other drugs such as dexamethasone, which is used, we will prescribe it for patients. We currently have no serious COVID illness patients in hospital, thankfully. The figure's back down to 0. And so at the moment, we're not in a situation where we would need those drugs.
Yeah, it's an anti-parasitic medication widely used in low and middle income countries to treat parasitic worm infections in adults and children.
Yes, that's correct, Paul. But like I say, there is trial data on both sides. The clinical trial data was referred to in a Senate hearing in the US a couple of weeks ago. But the trial data in lab trials shows it has an effect, but the human trials have shown some slightly different data.
Okay, the last one for now. Can you please ask David Ashford what happens next time a couple of cases slip through the net? Should we all be alert for the possibility of another damaging lockdown?
Well, we can never say never, because we have to look at the situation. This one was a bit of a unique one because it wasn't from one source. It was from multiple different sources. So it wasn't one particular cluster we were dealing with. You'll remember, Paul, when we had that other cluster, again, ironically similar to Guernsey at that time, we had that one cluster. We dealt with things very differently because it was one cluster. We had 2 clusters, and in this particular case, because of the amount of venues, and it was over the Christmas period that those individuals had been to, we could not say there hadn't been reseeding in the community. So that was why we took this firm action that we did in shutting things down so quickly. It would literally depend upon what type of cluster we saw emerging, and if we felt that it was widespread reseeding in the community.
Well, before I let you go, just to remind people that if you haven't had questions answered here, they're going to be holding a public one. The government, that is going to be having a Q&A, although it's not with you, it's with your CEO, which we don't see. The press don't ever get to see your CEO. I know it works in the United Kingdom and zooms in on these things, but she's going to be put up for questions on Wednesday. Is that some reason that we don't get her and
yes,
the public do?
The Director of Public Health, I believe, as well. I was hoping to do it myself, but unfortunately I've got a presentation to Tim Wood members around healthcare transformation that's on at the same time. It needs to be filmed, but I'll certainly do a future one. I did, I think, most of the public ones the last time round, and I quite enjoy doing them, so hopefully they'll be doing some more and I'll be able to do those ones.
And don't forget, please, more questions. I get them through the week, and I can only ask 2, as you know, at the press conference, which unlike Guernsey, they allow us to, they go a bit longer. But anyway, we'll do another one next week. Is that okay with you?
Yeah, it certainly is, Paul. You know me, always available anytime.